is important. It allows the body time to rest and rejuvenate. Did you know we spend over 1/3 of our lives in bed? Sleep that is poor in quantity and quality, as well as poor sleeping posture, can have a negative effect on mental health, motor functions, and overall well-being. Sleep allows the musculoskeletal system time to rest and relax. The spine is lined with many muscles that support and stabilize the body during daily activities. Sleep allows these muscles and intervertebral discs to relax after being under load most of the day and enables growth and restoration to occur. This project will focus on the importance of correct sleeping posture. The way we sleep and our posture can have a negative effect on our muscles, neck, and vertebral column, creating pressure on these areas and in turn causing pain and stiffness.
Positions: supine, lateral, prone, and a few other random ones thrown in. Have you ever woken up with back pain, a stiff neck, tingling in your arm? In a few minutes, we will have a solution for you. And others reported that 55% of people sleep on their side, so this is the position we'll be focusing on, and we will also take a look at the correct and incorrect supine position. A study by McConnell has shown that sleeping on a surface that is too firm, the erector spinae muscles were more active during sleep. The erector spinae is a group of deep back muscles that help with the extension of the spine. When lying on the side on a hard surface, the hip and shoulder are supported. However, the spine in this position is laterally flexed away from the mattress. The side sleeping can put pressure on the cervical and lumbar regions. This can lead to back and neck pain. The muscles involved with this pain would be the erector spinae, longus capitis and longus colli, scalenes, quadratus lumborum, and psoas major.
A mattress that is too soft can increase poor sleep, leading to lateral flexion of the spine, hip and shoulder, with the curve going away from the mattress. A slight rotation of the vertebral column automatically accompanies the lateral flexion. This can cause lower back pain due to over-rotation of the pelvis. Poor sleeping posture can also increase lordosis due to weak abdominal muscles, such as rectus abdominis, internal and external obliques, weak hamstrings, and gluteus. Lumbar lordosis is the natural curvature of the spine. These curves position the weight of the trunk over the body's centre of gravity, allowing for optimal balance when standing.
Also, having the incorrect pillow height contributes to poor sleep posture. A pillow that's either too high or too low creates lateral flexion of the neck muscles, creating muscle tension. The correct pillow should support your head and neck, allowing it to lie in a neutral position. It should fill the void in between the shoulders and neck, and also conform to the exact shape to the sleeper as it spreads the weight evenly along the vertebrae. Side sleeping causes a person's upper body to put pressure on the shoulder, which in the long term can cause unilateral or recurrent shoulder pain. The pain is caused because there's a small area of contact between the bed and the body. A side position can be worse than another side sleeping position depending on the angle of the thorax and the shoulder and the thorax and the bed. Older, less mobile people can experience more shoulder pain from side sleeping because of their postural immobility when sleeping.
A good pillow is needed to ensure that the neck does not go into cervical kyphosis or increase cervical lordosis. Incorrect sleeping posture puts strain on the neck muscle and makes them tight. The neck muscles involved in this are sternocleidomastoid, scalene, splenius capitis, and cervus, and longissimus capitis. The levator scapulae can also be involved.
Another common sleeping position that can have a negative effect on the vertebral column. Although lying supine has 20% less intradiscal pressure compared to standing position, sleeping in this position creates a pull on the sulcus major, creating it to increase the load on the lumbar spine, therefore increasing lumbar lordosis. Pressure while sleeping in this position is created on the pelvic and lower thoracic region. When the lumbar region is not supported, the vertebrae directly absorb the compressive forces. Inadequate lumbar support while sleeping contributes to lower back pain. For people who suffer from chronic lower back pain, lumbar support during sleep is essential. A good sleeping position, supine, with lumbar support for even distribution and contact pressure over the pelvic, lumbar and thoracic regions. Lumbar lordosis is maintained.
We also decided to analyse sleeping in a prone position. Similar to sleeping supine, sleeping prone can be problematic because it doesn't support neutral spine, which leads to increased lumbar lordosis. The additional pressure placed on your spine can cause discomfort and pain on your lower back that could negatively impact your mood and ability to perform daily activities. Your neck is also placed in a rotated position for a prolonged period of time, placing strain on the neck rotators. The neck muscles which are affected by rotation include the splenius capitis, splenius cervicus, semispinalis capitis, and longissimus capitis. There may also be a tendency to abduct and externally rotate your hip and have your knee in a flexed position. This creates a lateral pelvic tilt. Maintaining this sleeping position creates a strain on the ipsilateral gluteus medius, gluteus minimus, tensor fasciae lata, iliopsoas, sartorius, pectineus, and rectus femoris.
One, support the neck with a good pillow that ensures the spine is neutrally aligned. 2, choose a mattress that is neither too firm or too soft. 3, sleep in positions that support the vertebral column. For example, lateral with a pillow in between the knees, as it prevents pelvic rotation, or supine with lumbar support that maintains lumbar lordosis.